everyone, so let's move towards our today's topic, which is
neck is divided by sternocleidomastoid muscle into two triangles, anterior triangle and posterior triangle. Now in this lecture we will gonna talk about anterior triangle of the neck. Now you have to remember the boundaries, contents and so on, but before that you have to remember that this anterior triangle is present in the lateral region of the neck as well as in the anterior region of the neck. What happened that in the anterior, if you see your neck from the anterior side below chin, these anterior triangles, because as you know that anterior triangle will be present on the each side of the neck, right side and the left side, so from both sides they will come anteriorly and they will meet together in the anterior side of the neck, anterior region of the neck, and that meeting point consists of a line. Okay, that meeting point consists of a line, imaginary line between the hyoid bone and the sternum. Okay, so in other words, there is a line, imaginary line between hyoid bone and the sternum, and on that line both sides of the anterior triangle are meeting together. Now moving further, now we will gonna talk about the boundaries. Okay, superiorly base of the boundaries of the anterior triangle. So superiorly base of the mandible will be present, posteriorly sternocleidomastoid muscle will be present. As you all know, in the posterior triangle of the neck, when we were talking about the boundaries of the posterior triangle, I was telling you that anteriorly sternocleidomastoid muscle will be present. So in the anterior triangle of the neck, in the boundaries of the anterior triangle of the neck, it's very simple and it's very easy to memorize that posteriorly obviously sternocleidomastoid muscle will be present. Anteriorly, like I said, there will be imaginary line in the median region or the in the sagittal region, sagittal plane, and that imaginary line is between hyoid bone and the sternum, and that is present anteriorly. So you have to remember the boundaries. Now, which is the most important thing, which is very important, that anterior triangle is further divided into subdivided into four triangles. Okay, now if someone asks you, or if professor asks you that what are the contents of the anterior triangle, so you can easily memorize it, you can easily tell them after memorizing the all four triangles of the anterior triangle. Like I told you that anterior triangle of neck is further divided into four triangles. Number 1, submental triangle. Number 2, submandibular triangle. Number 3, carotid triangle. And number 4, muscular triangle. Now if you memorize the contents of all these four triangles, you will easily memorize the triangle of the anterior triangle of the neck. अगर आपको इन चारों ट्राइंगल के जो मैंने बताया, सबमेंटल ट्राइंगल वगैरह वगैरह, इन ट्राइंगल्स के आपको कंटेंट याद हो गए तो आपको एंटीरियर ट्राइंगल ऑफ द नेक के कंटेंट्स याद हो जाएंगे. नाउ सो वी विल मूव टुवर्ड्स द each triangle separately. First of all, submental triangle. Submental triangle is present below the chin, okay, or below the body of the below the body of the mandible. Okay, base of the mandible consists of a triangle called as submental triangle. Okay, it is present between the hyoid bone and the mandible. Above the hyoid bone there is a triangle called as submental triangle. Okay, submental triangle is also called as suprahyoid triangle. Why? Because it consists of suprahyoid muscles. Okay, that's why it is called as suprahyoid triangle. Now what are the boundaries? Boundaries are somewhat like superiorly, as we all know, we have discussed below chin, below the body of the mandible, there will be a triangle, and that triangle is submental triangle. So superiorly the boundaries are very easy to memorize it. Okay, if you know the concept of each triangle, if you know the basic concept of each triangle, you will easily memorize the boundaries also. सबमेंटल ट्राइंगल कहाँ होती है? बिलो चिन. तो सुपीरियरली क्या होगा? मैंडिबल. इन्फीरियरली क्या होगा? हायोइड बोन. ओके, लेटरली anterior belly of digastric muscle will be present, and the floor and the roof is formed by mylohyoid muscle. Okay, it's very simple. Digastric muscle. No, you have to remember that digastric. What the name indicates? What is the meaning of digastric? Digastric means consists of two bellies, anterior belly and posterior belly. Anterior belly is present below chin, and posterior belly is present on the side of the neck. Okay, it is attached with the skull. It is attached with the posterior side of the skull, and it is present on the side of the neck. And the anterior triangle is attached with the hyoid bone as well as on the mandible. So this anterior belly of the digastric muscle is forming the lateral side of the submental triangle. Now, what are the contents? As the name indicates, submental lymph node will be present, submental vessels will be present, and suprahyoid muscle will be present. Why suprahyoid? How to remember that suprahyoid muscle will be present? Like I said before, submental triangle is also called as suprahyoid triangle. Now, moving towards the second triangle of the anterior triangle of the neck, that is submandibular triangle. Now, submandibular triangle, as the name indicates, submandibular gland will be present. Submandibular lymph node will also be present. Okay, now contents भी आपको साथ साथ याद हो रहे हैं. Submandibular triangle is present below the submental triangle on the side of the neck. Okay, on the lateral side of the submental triangle, submandibular triangle is present, and this submandibular triangle is also called as digastric triangle. Okay, why digastric triangle? Because it is present between the anterior belly of the digastric digastric muscle and posterior belly of the digastric muscle. How? Anteriorly, submandibular triangle की अगर boundaries की बात करें तो anteriorly what will be present? Anterior belly of the digastric muscle. It's very simple. Anterior है तो anterior belly होगी, posterior है तो posterior belly होगी digastric muscle की, and superiorly base of the superiorly mandible bone is present. Okay, so below mandible bone and between the bellies, between the digastric muscle, between the two bellies of the digastric muscle, the triangle is formed, and that triangle is called as submandibular triangle. Now, contents. What will be the content? Like the name indicates, submandibular gland will be present, submandibular lymph node will be present, and also hypoglossal nerve, facial artery, and facial vein will be present. And you have to remember these three names in this content of the submandibular triangle, which is very important. कि facial artery भी है, facial vein भी है, और hypoglossal nerve भी मौजूद है submandibular triangle में. Now moving more further, carotid triangle. Now, as the name indicates, it's very simple that कोई ना कोई कैरोटिड आर्टरी इसमें मौजूद होगी, या तो इंटरनल या एक्सटर्नल या कॉमन कैरोटिड आर्टरी. बट आई विल टेल यू इन द कंटेंट्स ऑफ द carotid triangle. But what is carotid triangle? Carotid triangle is present below the digastric triangle. Okay, submental triangle was present in anteriorly. Okay, lateral to the submental triangle, submandibular triangle, or in other words digastric triangle will be present, and below digastric triangle or below submandibular triangle, carotid triangle will be present. Carotid triangle, you have to remember the main point that carotid triangle consists of more vessels, large number of vessels, large number of arteries, large number of veins. If I compare from other triangles of the anterior triangle of the neck, this triangle, that is carotid triangle, consists of more vessels and more arteries. You have to remember the boundaries. Now, superiorly, carotid triangle consists of posterior belly of the digastric triangle. Okay, anteriorly hyoid bone, omohyoid muscle will be present. Posteriorly sternocleidomastoid muscle will be present. Okay, and the roof, as you all know, that roof is formed by skin, superficial fascia and deep fascia, and the floor is formed by middle constrictor muscle of the pharynx. Now, like I told you that carotid triangle is present below the submandibular triangle, so it will be easy for you to remember the superior boundary of the carotid triangle, because obviously superiorly on the upper side of the carotid triangle or on the superior side of the carotid triangle, submandibular triangle will be present. Okay, on submandibular triangle consists of posterior belly of digastric muscle. So you will easily memorize it. Okay, posterior belly of the triangle is forming the posterior boundary of the submandibular gland as well as superior boundary of the carotid triangle. Sorry, submandibular triangle की एंटीरियर बाउंड्री बना पोस्टीरियर बाउंड्री बना रहा है posterior belly of digastric triangle, और posterior belly of triangle digastric triangle is also forming superior boundary of the carotid triangle. Anteriorly, like I said, omohyoid muscle will be present, or posteriorly sternocleidomastoid muscle will be present. Now contents. Now all the carotid arteries, internal carotid artery, external carotid artery, common carotid artery will be present in this triangle. Also veins will be present. Those veins are internal jugular vein, lingual vein and facial vein will be present. Okay, and the nerve is also present, and that nerve is vagus nerve, and you have to remember that what is vagus nerve. Vagus nerve is the cranial nerve number 10. Okay, now the last triangle, which is very easy, muscular triangle, and this triangle is present below the hyoid bone, or in other words you can also say it is present below the submental triangle. Above hyoid bone, the triangle was submental triangle, which we have already discussed, and below hyoid bone, muscular triangle will be present. It is basically horizontal in shape. Okay, horizontally present hoga. Superiorly hyoid bone will be present. Inferiorly sternocleidomastoid muscle will be present. Laterally omohyoid muscle will be present, and medially imaginary line between hyoid bone and the sternum will be present. In superiorly, as we all know, hyoid bone will be present, but inferiorly, how to remember that inferiorly sternocleidomastoid muscle will be present? Now as you know, the sternocleidomastoid muscle is present between the mastoid part of the temporal bone, and it is present on the side of the neck. So it will run from the mastoid part of the temporal bone to the sternum and the clavicle. Cleido means clavicle. So obviously it is coming from the side of the neck, and that's why it is dividing the neck into the anterior and posterior region, and that is why it is forming the inferior boundary of the muscular triangle. Okay, so inferiorly sternum will not be present, sternocleidomastoid will be present. Okay, and what are the contents? Obviously below hyoid muscle will be below hyoid bone muscular triangle is present. So obviously, as the name indicates, below hyoid bone infrahyoid muscle will be present, and infrahyoid muscle and below hyoid bone muscular triangle is present. So that means infrahyoid muscle will be the contents of the and should be the contents of the muscular triangle, and those infrahyoid muscles are sternohyoid muscle, omohyoid muscle, thyrohyoid muscle and sternothyroid muscle. These four muscles which are present below the hyoid bone are called as infrahyoid muscles, and infrahyoid muscle is the only content which is present, which is present in the muscular triangle. So this was the whole topic regarding the anterior triangle of the neck. Till then, work hard, study hard and good luck. Bye bye. Thank you so much. Allah Hafiz.